Alright, we're back for another video. This time we're going to do a pelvis. A female pelvis. Female pelvis. Alright, so let's register the patient. Browser. Scheduler. Patient registration. Fill in the information. ID. Date of birth. Form. Female. Alright. Now for a pelvis, patient can go in head first, supine, or feet first, supine. The way I scan, if I can scan any body part with feet going first, that's the way I like to scan, just because I feel the patient has more comfort being on the side where I'm at, if that makes sense. So we're gonna scan feet first and study pelvis, and let's rock and roll. So we got 20 million protocols. We're gonna do a routine female pelvis. Here we go. Alright, I'm gonna delete number 8 only because that's a long scan and our patient is volunteering. I'll let you know how you set it up. You set it up just like an axial, okay? We're not gonna use none of these optional ones, so we're gonna delete. And we're not going to give contrast, so we're going to delete those. Alright. So, let's get started. For the pelvis, we want to get the pelvis. Alright. Now, we're looking more into the pelvis organs, okay? I like to angle the way the sacrum is going and center everything else. We don't care about tissue unless they have a mass or abscess. Okay. That looks pretty good. All right, check our TR. All right. Now, we have 50% oversampling. Let's see if that's enough. We'll check that out with the first scan here. So we'll hit apply. Alright, so for a pelvis, we're going to do breath holds. It is not necessary, but it helps with your images if you do breath holds. Alright, so let's get ready for the first one here. We're doing a coronal, okay? That's what we set up. All right, go ahead and hold your breath. So you gotta be very careful on the breath holds. The one she's doing right now was 17 seconds. This axial that I'm about to set up is 16 seconds. Breathe. I try to keep them as low as possible because I kind of put myself in their shoes. You know, can I hold 17 seconds? Can I hold 20 seconds? And you got to remember that these patients are in pain, right? I'm not in pain right now, so maybe I can last a little bit longer. So be mindful of that. So I'm just going through these images, making sure that my oversampling was enough, and it looks like it was. If it wasn't, you will see part of the femur up here, you know, or pelvis wrapped around here or down here, but the anatomy looks good. All right, so now we're gonna set up the axials. Now, once again, I like to angle with the sacrum. Okay, here's my angle. Remember your face direction. Okay, the coronal was going head to feet. This axial is going anterior, posterior. So we gotta make sure we get enough space. Okay. So here we are. Remember, we just care about bladder, uterus, ovaries. Okay. Because it's a female pelvis. Okay. Remember my motto: more is better than less. All right. That looks pretty good. Looks like we're getting everything. Once again, 17 seconds. It looked like she did pretty good on this coronal. So let's go ahead and hit apply. All right, go ahead and hold your breath. Now the scanner is gonna tell you, I'm not sure if you can see this here. It says scanning, breath hold, 1 of 1. We're at 7 seconds to go. Breathe. All right, so let's go ahead and look at this one here. Still breathing. All right. So, sagittal. This one just straight on. Okay, as you can see right here, this will overlap to this side. Okay, and let's go through this axial here. You can see that the backside, it looks like we're pretty good. Nothing's going over that. Now let's look up here. All right, looks pretty good. All right, let's check our TR. All right, now here I like to scan. I want to get the whole symphysis pubis here, the pelvic bone here. So I'm going to add, and remember, more is better than less. All right, that looks good. Nice and centered. Good. Let's look at our coronal. And good. I'm actually bring this one down just so it can be even. All right. All right, go ahead and hold your breath. All right, so these next ones, they're all axials, axial, 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 and axial. All right. TRA and Siemens is axials, okay? So all we have to do, breathe. All we have to do is copy and paste, all right? So let's look at our sagittal. not bad. A little grainy, but not bad. All right. So look how this opened up, right? This is your in and out face. So we're gonna select this axial, right click, copy parameter, slices, okay. All right. So it's telling you it's gonna change the slice thickness, okay? All right, and it's gonna give it an extra, I hate saying this word, concatenations, okay? And hit okay. All right, so let's go back and see what slices this axial was. All right, all you gotta do, if it was already scanned, you double click on it and it opens the card. As you can see, there were 5s. These ones are 5.5s. To me, I want to give the doctor the same slices for the axials. So if this axial was 5, I'm going to try to give these doctors a 5 as well. Okay, let's look at the field of view, because the field of view was good. 320, 90. All right, 1 second. All right, sorry about that. All right, here we go. So what I was saying is, let's copy this card, right? The field of view and the slice thickness the same. Okay, so we're at 320, that's the same. 90, we're at 87. Let's go up one more. But remember the time. Okay, so if we go up 93, we're looking at 15 seconds. If I go down to 87, the way it was, it goes to 14 seconds. All right. Now, let's see if we need some oversampling here. Doesn't look like it. So I think we're good with 87.5. All right. Now, slice thickness. It says 5.5. This one says 5. Let's change that to 5. Okay, the scanner doesn't let me. All right, so let's see if we increase this TR. No, it doesn't let me. All right, so we'll leave it at 5.5. Let's do 2 of these. All right, that should be good enough. 15 seconds. Close and apply. All right, go ahead and hold your breath. All right, so let's copy and paste. Now, we don't want to copy from this one, because remember, this one was 5.5 and this one was 5. So let's copy the 5. All right, breathe. Now it's saying again 5.5. I wonder why. Yep, that's as low as it goes. So this was 2 concatenations, so there's going to be 2 breath holds. Hold your breath. Breathe. All right. Well, since this one's 5 and this one's 5.5 and this one was only 5.5, let's just do 5.5s then. Okay. And apply. All right, go ahead and hold your breath. All right, this sequence here, it looks like it has some sidebands here. This here, basically, whoever created this sequence wants to blur out the breathing, okay? Breathe, and the arterial, okay? we have some problems here. Cooling. Okay. All right. So we have a scanner problem. So what we're gonna do here is let's see if it'll continue that in a scan. All right. So we're gonna copy. Let's do this quick, and then we'll attend the machine. Remember, the safety of the patient is priority, okay? All right. So here we go. All right, it's not gonna let me scan, so I think we're done here. But you got to see the coronal, axial, and sagittal. So I'm gonna stop this video, take care of the patient, and take care of the scanner. All right.